Welcome to the Bare Naked Shrinks.
Hello, and welcome to this episode of the Bare Naked Shrinks with me, Dr. Danny, and my amazing co-host, Dr. Courtney.
Hey.
And today we have the pleasure of having Dr. Tiffany Brown with us. She is the assistant professor in the Department of Psychological Sciences at Auburn University and the director of the Appearance Concerns Eating Prevention and Treatment, or ACCEPT lab. She also co-directs the Auburn Eating Disorders Clinic and is a master trainer for the Body Project. Wow, very accomplished, Dr. Brown. Welcome.
Thank you. It's great to be here.
We're so excited to have you.
I was saying before we started recording, so Courtney and Tiffany were at UCSD together. Tiffany, you were at UCSD after me. Do you remember how we met? Because it's kind of a funny story.
I do. Was it the melatonin?
Yes.
I do. I'm not sure if that was like illegal in giving a melatonin.
It was. That's why it was so funny. So we were in Prague for ICID. What was it? 2018, maybe 2017? And I had never had, what do you call it? Jet lag. I had never had jet lag before when I traveled, and it was awful. And somebody was like, oh, you need melatonin for jet lag. And I was like, okay. And apparently you can't buy it in the EU. It's like illegal. It's like an illegal substance or something. And everyone's whispering. And I was like, Leslie's like, I think Tiffany has some. And so then she gave me some, and I was so grateful because it really did help. And then we were out one night. I think we were like with Walt and stuff. And do you remember, Tiffany? I go, thanks for the drugs. You were like, God.
Please. No. And I was like, no, melatonin.
Yeah, she just kept saying melatonin.
You would, Danielle.
I know.
I'm not a drug pusher. I just wanted you to be able to sleep naturally.
Oh, that's hilarious.
It was great. I had to tell that story right off the bat. So later in the show, Tiffany is going to talk to us about the Body Project. But to start things off, let's get into our
cake and crap.
I'll start with crap. I guess is that Matt's gone. It's been a hard week, just kind of figuring out how to manage like pick up, drop off kids. I had to rearrange some patients, which I felt bad about because I have people that I see late that I couldn't see late. But it's fine, you know, it's only 2 weeks, but that was probably my crap. And then Cake has probably been like getting some one-on-one time with my kids. They've been really fun and funny. Lively was like playing the harmonica yesterday, and I'm not joking. She was actually good. She just like picked it up. She's so musical. And then Wilder, I sent this also to Courtney. He was doing this homework assignment that was teaching division. So like Tiffany, for example, had like 12 strawberries, and it was like, put these into 3 groups, and like how many groups would 3 strawberries per group or whatever, you know? And then the final question was put 5 into 7 groups or something like that. He literally wrote the number 5 7 times and circled it. I was like, that is my child. Work smarter, not harder. I literally didn't make him correct it because his teacher, like, she gets it. She would be like, good job, touche. So that's my cake, is just spending more time with my kids that I think are amazing. How about you, Courtney?
My cake was probably last Saturday. So I had a day planned with my 2 closest friends here in Seattle, Kelly and Mackenzie. And we went to Snohomish. It's like, I don't know, 45 minutes from Seattle, kind of a cute little quaint town. And it has this like main street with a bunch of cute like shops and cafes. And so we went there and we spent all day just like going through these shops, and we got some like savory pies for lunch, and we made friendship charm bracelets, and then saw a gorgeous sunset. And then on our way back, we stopped by Red Robin because we were craving French fries. And then we went back to Kelly's place and like watched the Wicked documentary. And then we ended the night with going to our favorite bar, Camp. So it was a busy day, and it was just really fun, like hanging out with my 2 closest friends here. And yeah, so that was definitely my cake. My crap would be this week it's been 2 years now since Greg dumped me on a boat in Indonesia.
This is the anniversary week?
Yeah. And Yeah, I had more emotions about that than I thought I would. So I think just kind of processing that and, allowing myself to like sit with my feelings and allow myself to cry. So yeah. Yeah, I would say that was my crap. What about you, Tiffany?
I would say my cake, I guess, to start off with, well, I guess it would kind of go together. So I kind of this week was challenging just with like the end of the semester and like having a lot on my plate and having some other like stressful things I won't go into that happened. But I feel like the upside was that I like it just really reinforced for me how great my colleagues are, how great my lab environment is, my students, like, and just made me really, I guess, grateful post Thanksgiving too for just the good support that I do have, even when things are stressful.
All right. Well, Tiffany, you have the gift of being part of a new segment that I literally just created called Would You Rather Shrink Edition.
Would you rather shrink edition?
All right. You ready for it? So we all have to answer, okay? And the caveat, so you have to answer and you can give like a slight explanation, but like don't get too far into it. Courtney, I'll have you go first just so Tiffany doesn't have to be the first one. And I'll start off a little mild. They get interesting. So, would you rather meet a new patient for the first time wearing pajamas or a ball gown?
Probably a ball gown.
Okay, Tiffany.
I would have said pajamas because I think I feel uncomfortable when I'm too overdressed. It depends, I guess, on what kind of pajamas they are, would be my caveat question.
Well, like just like matching regular like pants and button-up shirt kind of thing.
Yeah, honestly, sometimes the things that I wear in regular life could probably be pulled off as pajamas. So I feel like I would go with that.
And I mean, we all know I would choose ball gown. Like,
Yeah.
I kind of would wear a ball gown just if I had one for fun. Okay, next one. Would you rather accidentally send a patient a flirty text message meant for your significant other or forget to mute your mic during a Zoom session and toot?
So I've actually done the latter, and it wasn't
Me
a
too,
Zoom.
that's why I thought of it.
It wasn't a Zoom session. It was group supervision during COVID when I was on the adult team. And the entire adult team heard me and like all texted and they were like, oh my God, did you just fart, Courtney? So that has already happened to me. So been there, done that. So I would probably have to say the flirty text.
All right, Tiffany, you.
Oh, wait, would I rather?
Yeah, that's
I
what I
would
would
rather do the tooting. I don't want to send a flirty text. Yeah.
Oh, okay, yeah, okay.
wholeheartedly agree. Would rather toot on the Zoom.
But it has to be a Zoom with a patient, not just anyone.
I think I would just use that as like radically that our bodies do things sometimes, and just
How
yeah.
funny. I mean, I'm very like 2D and open about it and stuff, but with patients, I don't know. I feel like I would rather send a flirty text. I didn't say like a nude, but I would rather send a flirty text and then be able to repair for it and be like, oh my God, this is not my husband. Haha.
I would not at all.
Me neither.
Would be mortifying.
I'm on board.
Okay. Would you rather have patients who can only communicate via emojis? Like even if it was in person, they just emojis come out, bubbles out of their head, or patients who can only communicate with Taylor Swift song lyrics.
Oh, Taylor Swift song lyrics. Obviously, that'd be so fun. We've already done that.
I know. That's why I thought it would be fun. Tiffany?
I was going to also say Taylor Swift song lyrics. I feel like there's a lot of emotion. There's a lot of words in there. You could do a lot with that.
Right. Like you could communicate for the rest of your life with just Taylor Swift lyrics, I think. Yeah. Okay. Would you rather have 10 therapy sessions in a day with your average patient, who I like love my average patient, or one therapy session with Donald Trump?
Oh, 10 therapy sessions with my average patient, 100%.
Yeah.
Tiffany?
Oh, agreed. Yeah.
Sure, I'm going to be the outlier and say Donald Trump because this is my like narcissism showing. I feel like I might be able to do something in an hour with that fool. Maybe. I think I might. Okay. Would you rather conduct a session with a piece of lettuce on your tooth or with a booger on your nose?
I mean, I've probably done it with a piece of lettuce on my tooth, given that we work in eating disorders. Honestly, I've probably done it with more than that. So yeah, the food, definitely.
Yeah. Lettuce on the tooth. I mean, I guess both of them would be ultimately fine, but I feel like lettuce on the tooth would be, I probably have done that and not noticed it and it's been fine. So
I don't know why I'm really weird about food on my teeth. I think I would pick a booger because I also feel like people give cues about that. I love, Courtney, how I just continually surprise you. Okay, this is a fun one. Would you rather conduct a therapy session with a boob accidentally hanging out or walk down the street where nobody would know you at all, totally nude?
I would rather walk down the street totally naked without anybody knowing me. Yeah.
Tiffany?
That's really, I don't know that I've ever thought about this. I would say I feel like that would be so uncomfortable in a session to have any sort of thing happen. It would be so awkward for the client and so awkward, and it would just be some therapy rupture there. So I feel like I guess I would say walk down the street.
I would too. I would too. I think that shows us how much we care about our patients. Like, I kind of thought we all would pick that. And I love that because, yeah, we want to maintain that therapeutic integrity and would never want to put our patients in an uncomfortable position to be like, tuck it back in, doc. So, would you rather give therapeutic recommendations using only advice from fortune cookies or only advice from children's books?
Probably children's books.
That's what I was going to say. I feel like there's some wisdom in
Yeah, me
children.
too.
There's a lot of them out there.
There are. It's funny. I choose fortune cookies because I think they just sound so smart. Okay, last one. This is a fun one. Would you rather have your therapist voice, like you could only talk in this voice in therapy for the rest of your life? Would you rather have your therapist voice be Fran Drescher from The Nanny or Pee Wee Herman?
I don't know who Fran Drescher is.
Stop it. She talks like this. She's like, hi, guys. And then Pee Wee Herman is like, hey, Pee Wee. Oh, I can't do Pee Wee Herman. He's like, hey. That was Fat Albert. I don't even know. What am I doing?
Maybe Fran because she's a woman, and then I have a woman voice, and it would match that.
That's fair. I would say Fran Drescher too, because I feel like, everybody liked the nanny. Like, she has a lovable quality to her, so I feel like I would.
I know, she really does. I mean, I think Pee Wee's voice is really cute and funny, but I think I would land on Fran Drescher and The Nanny too. Okay, that was fun. So after all that fun, let's get down to the educational portion of the day.
Scars to your beautiful.
Mwah.
So I'm really excited to talk about the Body Project, which is a dissonance-based eating disorder prevention program. And I've been working with the Body Project, since probably 2010 at this point. So I have loved getting to be involved in it at various kind of stages. But the Body Project, as I said, is dissonance-based eating disorder prevention program, and it's based on cognitive dissonance theory. If for everyone who's the listeners of going back to kind of like intro psych for cognitive dissonance, basically that happens whenever you have either two thoughts or beliefs that kind of are jarring with each other, or where your beliefs and your actions aren't aligning. And basically that causes us to experience a mental conflict that we call dissonance or psychological discomfort. And we as humans really do not like to contradict ourselves. We like to be consistent. And so whenever we do experience dissonance, we end up trying to resolve it in some way. So that could look like a lot of different things depending on the thoughts and behaviors. But for a kind of body image example, a lot of people might look at social media images and think, looking like, XYZ on social media would just make my life so much better. And at the same time, they may think, well, I don't look like that. I don't look like those people. And so they might be motivated in some cases to try to resolve those by pursuing what we would call the appearance ideal, where they might end up trying to conform to look more like people that they see on social media, maybe engage in dieting behavior, other disordered eating behavior. And that would be one way to resolve it. Another way, though, that the dissonance-based eating disorder prevention programs use is getting people to actually actively argue against those sociocultural appearance ideals. And the idea there is that if you're kind of reducing the attention that way of actually looking at somebody on social media wouldn't actually make my life any more valuable or better, it decreases that tension that way. So you are able to kind of move on with your life and engage in a healthy way. And so the Body Project, really all of the activities are then set up to really maximize that cognitive dissonance, to really help ultimately kind of reduce what we call appearance ideal internalization. So the degree that you think that your appearance is the most important thing or most valuable thing about you. And that is a really potent risk factor for eating disorders. So by reducing internalization, and body dissatisfaction, you then also reduce eating disorder risk. And the Body Project, another really cool aspect of it is that it incorporates peers. So it's a group-based program. And you can have clinicians or professionals leading the groups. There's some research that actually shows that it is more effective when you use peers. So people who are kind of in the same age group. Often that might be undergraduate college students, or depending on the demographics and group you're working with, somebody who's a member of that peer group, because there is such a really important influence of peer behaviors and modeling on eating behavior and body image, either for good or for bad. So this can kind of use that in a positive way. And there's been a ton of research on the Body Project. A lot of it has been, and I should have actually said this in the beginning, but the Body Project was originally developed by Eric Stice and colleagues, and then has been kind of adapted for more of the peer facilitation version. That work was done by Carolyn Becker. And then there's been lots of other independent research groups outside of those two that have replicated these effects. But we know that the Body Project is more efficacious than like an assessment only control. So just not doing anything and getting assessments at the same time period, and also active controls. So either like doing a expressive writing activity or reading a brochure, or even time and attention matched groups where you're talking about body image and media influences, but you're not engaging in dissonance related activities. And the Body Project has been shown to be superior to all of those programs at the end of the program, so kind of post-program, and then with effects actually lasting up to 3 years. And I didn't mention this, but the program is actually only 4 hours worth of content, either spread out over 4 1-hour sessions or 2 2-hour sessions. So it's actually really impressive that short of a program can lead to that long standing of effects for 3 years. And then it's also one of the only programs that actually truly doesn't just reduce eating disorder risk factors, but actually reduces eating disorder onset. So it's the only program that has really consistently shown that. There, kind of across research studies, there's about a 58% greater reduction in future eating disorder onset in the Body Project compared to alternative interventions. So again, really, I think incredible for how brief of a program that it is.
Definitely.
Yeah, it's exciting. And it's also just, I will say anecdotally, I have been a master trainer for the Body Project for several years now, and then did a lot of work with the Body Project and trained a lot of groups prior to that. And it's also just really fun. And people really do talk a lot about, and I know Courtney has done a lot of Body Project work as well. It's just really fun. It's really like empowering. I think it's fun as a leader when you're doing it, and the leaders get a lot out of it. All of my undergraduates in my lab right now have at least gone through the training for the Body Project, and it really can be life-changing for people. And so it's really exciting to just see that as well. But overall, the program, again, as I said, could be 4 sessions, 1 hour each, or 2 2-hour sessions. And generally, I could go into more details about like the activities themselves, but it's all about challenging that appearance ideal. So there's things like first kind of defining what that means, what it looks like in our culture, and then really focusing on the cost, not just like monetary, but mental health cost, social cost, educational costs, or work costs, and kind of running the gamut there. And then there's a bunch of different between session activities that folks do as well. So things like writing a letter to a younger adolescent or younger teen experiencing body image concerns or pressures. You do things that you would normally avoid. So we call it like a behavioral challenge. So like if you are afraid of, wearing tight clothing in public, you actually go test that out and go wear tighter clothing. And then you come back and kind of like process how that went, what you learned. And most of the time you learn, I thought everyone was going to care, or people were going to like point at me, or I was going to get excluded, or something bad was going to happen. And then ultimately it ends up being that nobody noticed, or if they did, they didn't say anything, they didn't care. I just kind of went along my day and it was fine. And then we also do a lot of role plays, things like challenging what we call negative body talk. So statements people make about their or other people's bodies, work on kind of like developing skills to become a body activist. So actually trying to change your environment, whether micro or macro environment, at least in some way around body image topics. And then there's several like activities that you do to sort of wrap up to continue the progress that you've made from there. So yeah, a lot of cool stuff within that short period of time.
Okay, Dr. Tiffany, can you and Courtney maybe do a role play of an example, like have Tiffany be the like leader or the peer, and Dr. Courtney be the person in the group?
Yeah, definitely. Okay. So, Dr. Courtney, I'm going to have to say a statement, and I want you to, based on everything that we've learned and kind of talked about so far in this group, I want you to be able to show me that you really don't agree with the kind of statement that I'm saying, or say something to kind of change the subject. So, are you ready?
Yes.
Okay, I'm going to give you a statement and then just come back at me. So, I'm way too fat to wear that outfit.
Tiffany, come on. You're gorgeous. I think that you are perfect just the way you are. And that outfit, you rock it.
Yay. That was great, Courtney. And so you would kind of go through, you basically would do that and you would go around the group and you would do that like at least a few times with different statements. And we have a bunch of different examples. Leaders could also pick something that they've heard if they feel like that's more relevant or something than an example that we have too. So, and that was really good. And I think like also it is like really challenging too. So I think a lot of the times when we're put on the spot for these things, even though like obviously I know you have combated negative body talk a million trillion times, and it's really there is something about the group experience of doing that. And when you're saying it in front of other people, it puts you on the spot and it really makes you feel like you're having to commit to what you're saying, right? Like that you truly believe it. And that's part of like the dissonance also working. And it can be uncomfortable for folks who haven't done it before, but even people who have, I remember still sometimes there's ones where it like, something will really stump you, and it's meant to be in the moment helping you to practice how you might challenge body talk out in the real world. But also there's so many factors that can come in there. So it can be really tricky.
Do you use like social media in a way? Like, for example, I sort of came up with this on my own when I was living in a bigger body after having my kids. I realized I was experiencing a lot of like internalized weight stigma that I
Yeah.
never even realized I had. And so I started following a bunch of like body positive and a bunch of fat activist accounts, and I still do to this day.
Yeah.
And I love it. It really it makes me feel so positive and powerful. Is that part of the process?
Yeah, so definitely, I think one thing social media just can have so much influence on, right, how we engage and think about our bodies, other people's bodies. And it's not explicitly part in there, but often what people will do for like certain activities and challenges that we have will be to kind of, either stop following people that are kind of contributing to them making negative body comparisons or not feeling good about themselves and what their body can do for them. And so, yeah, and then we do, definitely, we don't have, I know some variants of the Body Project people have given like lists of, kind of more body positive, body neutral activists or influencers. And I do think that that's really helpful. I mean, I follow a lot of those people too, and it just it just is a nice thing to see in your feed rather than something that's causing like a negative reaction in yourself. So that's definitely part of it. And I think for some people, even just stopping following people that like are not helpful, that can be huge. Like people don't even need to follow people. Like you can follow, I don't know, like, cats, or you can follow, if you're into home decor, I don't know, you can follow like anything on social media. And I think part of it is if people are wanting to kind of go in a body positive direction, kind of working towards that. But there are also some people that might not be realistic for too. And so kind of from a neutral perspective or body functionality, it might be like, I'm just going to not have as much of this kind of content that I'm exposed to. And, it might be more about, again, trying to help me think about what do I like about myself? What do I bring to the table outside of anything appearance related as well?
Yeah, that is good. That is true. Because I'm thinking, okay, I also follow like a bunch of golden retriever accounts, and they never make me feel bad,
Yes.
ever.
Yeah, exactly.
Tiffany, could you talk about some of the adaptations that you've done to the Body Project in your work?
Yes, I would be happy to. So yeah, I was going to say that also just more broadly, the Body Project has been like implemented really widely across the US and across the globe too. So it's, I think, probably way more than this now, but like over 140 college campuses run the Body Project in the United States. And then 100 and over 125 countries across the globe run it too, through various different like offshoots and adaptations, like Courtney mentioned. A lot of the work that we've done in our lab for our body project adaptations has been around trying to be more inclusive around gender. And in particular, we started, part of my dissertation actually was focusing on adapting the body project for gay and bi plus men. And so we've done kind of several trials now, and then those have been replicated by amazing colleagues in Brazil as well. And they've shown kind of what we would expect, really strong effects in improving eating disorder risk, and then actually 50% reduction in eating disorder onset in our most recent trial, which was really cool to see over a 2-year period. And then we've also done some adaptation work more broadly. So when I was doing that work for my dissertation, I had several men who inquired in, and they were like, well, I'm straight. I don't identify with this group, but I really do feel like I could, benefit from participating in this program. And I was like, well, like not a good fit for this, particular program, but why don't we actually adapt it? We have the infrastructure here. Why don't we do more adaptation for men more broadly? So we kind of set out to do that. And yeah, I could talk about the process more of how we did that. But we also have been testing that program and just wrapped a kind of a comparative trial with an alternative intervention control here at Auburn, where we did that actually at both UCSD and then at Auburn University. There have been some adaptations of the body project more broadly for LGBTQ folks. And so the ones we've done have been more with populations of men, but then there's also been versions more broadly for women and folks of all gender identities. And in those programs, the body talk, we don't just focus on negative body talk per se, but we also focus on challenging gender and sexuality related kind of talk, so to speak. And so one of the things that often can come up is kind of stereotypes around who looks like a queer person. So I thought maybe we could practice one of those statements that you could challenge too. All right. So Courtney, you don't look like a lesbian.
There's no one way to look like a lesbian. Actually, lesbians can look any way, any type, any style. And yeah, there's no stereotypical way to look like a lesbian. We can look however we want.
Excellent job. And I would say, yeah, very real with
Well, it's very real for me. I mean, when I came out, that was like the number one thing that I continued to hear is like, well, you don't look like a lesbian.
Yeah. No, that was great. You did an awesome job with challenging that.
I've had some practice.
You're like, I'm ready. I've got my responses.
Okay, how about one for like older women or postmenopausal women and, body or image concerns?
All right. So Dr. Danny, based on everything that we've talked about, if I said something like, well, aren't you kind of over body image concerns at this point at your age? What would you say to me?
I would say that body image and appearance standards do not have a age amount. We can feel negative or positive things at every age. And just because you're aging doesn't mean that you don't value your appearance. And with age does come a level of wisdom and letting go and realizing that there are some things more important than appearance, but you can also still value your appearance in a way that isn't, self-indulgent or creating negative emotion.
That was a very good one with like lots of layers in it. So what if I said, I need to look young to be attractive? What would you say to that?
I would say attraction is in the eye of the beholder or in the eye of the person who is aging. And youth doesn't necessarily equate attractiveness. I think there's also a lot of beauty in aging and wisdom and a lot of sexiness in being an older woman and being confident and knowing who you are.
Oh, that was really good. Yeah, that was great. I feel like, so that's the kind of activities that you would do in the group. You'd basically be doing a lot of those.
I can see, I have no experience with the body project, but I can even just doing that right then, I can see how beneficial that feels.
Oh yeah. Cause it is. So it's like, it's framed as something where you're asking these things, you're responding to somebody else, or you're, talking about somebody else, but it's really like you make the argument that you feel would be the strongest argument, right? So it's like, you're saying it to yourself, even if the statement isn't referring to you. And so it's like you make your own kind of best case. And really within the program, it's really cool to see people in the first session where they start this and maybe they struggle a little bit because it is really challenging. You both were great at it, but also I know you're clinicians and have been working with eating disorders for a really long time. And so are used to combating these kind of statements. For people who aren't, it can be really challenging. And it's so cool to see the growth from session 1 to session 2, people who really struggle and might pause and get some support from the group. The second session, it's like they can just, knock these out. And it's just really, again, amazing what kind of change can happen so quickly. And again, there's so many opportunities for us to challenge those kind of statements in everyday life that, it's something that is good to build up as a skill.
Totally. Okay. Well, thank you so much, Dr. Tiffany. This has been great. And I can't wait to share all the visuals with our audience and some activities because I think anyone could benefit from these activities. So let's get on to
Interview the expert.
all right, Dr. Tiffany, I feel like we always start with this, but it's telling. Like, what is your background, like your nuclear family, where you grew up, where you're from, like what was your upbringing like?
Yeah, good question. So I'm from San Diego originally. And so my family, I have my mom and dad are still together. And then my younger brother, who's 3 years younger than me. So we all grew up in San Diego. My parents are still in San Diego. My brother has since moved off and is in Oregon. But yeah, I feel like I have still, my parents just were here for Thanksgiving. I have very good relationships with them. Yeah, they've kind of followed me. I've traveled a lot through my schooling and jobs and stuff. And they've been super supportive and have come out and visit me very frequently, which I know I appreciate. And my dog also very much appreciates too. All of the grandparent love for the dog. So,
What kind of dogs do you have and what are their names?
Just one. So she's sitting right underneath me, but she's a mini schnauzer named Stella.
Oh.
Yes, very basic name for a dog, but she's very cute. So,
And speaking of the moving all around, I think people don't really understand how much of that we have to do to get where we are in our careers. So maybe you could do like a quick jump through the map of where you went for everything, starting in high school.
Okay, and so in high school, I was in San Diego, and then I graduated, and I was a swimmer in high school, and then in college. So I not went to school for swimming. I went to school for academics, but I did swim throughout school and was recruited for swimming. And so I started at Tulane University in New Orleans. I was there during Katrina, so we had to evacuate to Texas A&M. So I was there for the fall semester, came back to Tulane. They cut our swim team. I had to decide if I wanted to keep swimming or not. I did. So I got re-recruited and then ended up at Villanova University right outside of Philly.
So that's a lot you'd moved 3 times for college.
Yes, I did. 3 colleges in 3 semesters because it was, back to back. So I ended up there and then came back to San Diego and I worked for the UCSD Eating Disorder Center when it was in its beginning stages as a research coordinator. And then I went to graduate school in Tallahassee at Florida State University and then went back to San Diego and did my clinical internship and postdoc and then was a research scientist and psychologist there. And then now in Auburn, Alabama.
That is a lot of jumping around. What is it like, having grown up in SoCal and then now living in pretty much the deep South?
Yes, definitely the deep South. Yeah. I feel I think because I have actually spent a lot of my adult life in the South, really between Tulane and then Tallahassee for a while, I was sort of used to it, but it is definitely different, a cultural shift in the deep South because North Florida is a little bit different still from Alabama. But I think I was, I guess, so again, used to kind of being a little bit in Southern culture. They're very I don't know, in California, I used to joke, I did not know all of my neighbors growing up. It was just kind of you do your own thing. And here it's people are so much more friendly and in a very, oh, come over, you can have some sweet tea or very kind of some of the cute stereotypes about, friendliness here and everything too. And so, overall, I really like it. I love my position at Auburn University. It's been really wonderful. And I love my colleagues in the department. And it's a lower cost of living out here too. So that has been been huge. But yeah, definitely some major cultural differences. And interestingly enough too, well, maybe not surprising, but we haven't actually looked at this in our data yet, but we did one of our trials in Southern California and then one in kind of Alabama and West Georgia. And anecdotally, it's really interesting to just see like the body differences in body image pressures too, for men, at least between those areas where I think that there's like other factors that need to be considered within some of the body image concerns with men in the Deep South that certainly there can be a lot of similarities across, but I'll be interested to see if we do see any actual differences there. So
Yeah, no, that totally makes sense. I mean, beauty standards even differ state to state and region to region. I always tell people that the way women, the beauty ideal in Oklahoma, like where I grew up, is what people stereotypically think of like the Real Housewives of Beverly Hills. Like if you saw like the Facebook pages of people I went to high school with, you would be like, huh? Like it's very, very interesting how it varies region to region. So I bet doing research in different regions is fascinating.
yeah, no, it is really interesting, and I think there's been less research on it than you'd think there would be because I think it's something people do talk about how different cultural norms can be, but yeah, it is really fascinating.
And okay, so being in the South, I love Southern food. It's my favorite food ever.
Ooh.
What is your favorite Southern dish? You've got mac and cheese, you've got grits, you've got shrimp and grits, you've got fried chicken.
I would say that shrimp and grits is probably my favorite because I love shrimp, I love grits. The combination is very good. And even though I'm kind of strange in that, like I don't really like cheese. I know it's like a strange one. Yeah, and many people who know me know this about me. I like certain types of cheese. It's like a very specific textural kind of thing. It's not been impairing, but it is like, yeah, my one kind of quirky food trait. And so, yeah, so there's a lot of stuff that like the mac and cheese, it would not.
Wow. I literally just had a conversation with Matt like before he left town. I was like, you name one savory food that isn't better with cheese on it. Like we had this full conversation and he was like, I don't know, like peanut butter. I was like, nah, peanut butter and brie, that would work. And he was like, you're right. So I'm very against this, Tiffany.
I know, yeah, you're not the only one. But then people, if I like, then they get the extra cheese on things. You can just have extra cheese.
I remember when Erin did that PowerPoint party, Tiffany. Didn't you do yours on like why cheese is the worst?
Yeah, I did. I won the most, like, I didn't win any actual like votes for people agreeing with me, but they did say I had like the most uphill battle or something like that for mine. Yeah.
I need to see that slide. Okay, so final question. What is your favorite part of your career? And what is, I guess these are two questions in one. Favorite part of your career, and what is something unexpected in your career that you never imagined when you were in grad school?
So maybe the unexpected part in graduate school, which maybe I should have known or could have anticipated, so I'm like a traditional kind of tenure track academic position. And the one thing that I didn't expect is maybe the number of emails and also just the amount of like, not even the amount of like, you're really managing a lot of things. So you're less of, you're doing the science and the stuff that you think is really cool, but you're actually executing less of that. You have folks that are big teams that then help you do that. So you're more like doing things further and further away from the actual work that's being done, which I don't think that I had fully maybe like understood to that degree. And I would say I think the things that I like the most are the actual, when I do get to do the actual research, and I actually really like grant writing and coming up with new ideas and, really thinking through how you're going to execute that kind of idea. And then it's really exciting when you actually do get to do that and have it come to life. But then I also think mentorship, that was a huge reason why I kind of made the move to this sort of career trajectory, because I really wanted to mentor kind of the future generation of research scientists. And that's been really rewarding, and it comes with its own challenges and everything too, but is one of the things that I really just love and am proud of. I have a really awesome group of graduate students and research coordinators in the lab.
That's what all of our researchers have said. They've talked about their teams. So I love that. I love that theme.
Yeah, that's very true.
Yeah. All right. Well, thank you so much, Dr. Tiffany. I've loved learning more about the Body Project, and I can't wait to share it with our audience. And lastly, do you have anything for our homework?
Work it, y'all.
Okay, so I do have a homework assignment. I would say one of my favorite activities from the Body Project is writing a letter to, it could even be a younger version of yourself, if that would be powerful or kind of meaningful to you. So either a younger version of yourself or like a young woman experiencing body image concerns, and kind of using the discussion we've had today and just kind of everything you know about the costs of the appearance ideal. And yeah, write the letter and maybe try to make it as long as you can, because the longer the better, and kind of more you can dig into everything.
Because you process more with more detail, right?
Exactly. Yeah. And you just get more kind of, it's again, helping you to kind of remind yourself more and more about what are the things that really are important to you, and why you wouldn't want to pursue the appearance ideal, and why you wouldn't want a younger person to.
Awesome. Well, thank you. And thank you so much for sharing your knowledge and being with us today. And it was great to catch up because we haven't seen each other in a long time. So stay tuned for our next episode, Fat Bottom Girls, with Shavise Turner talking about weight stigma and the health at every size approach. So we'll see you all next time. Bye.
See y'all next time.